This is a plain CT scan of a 68 years old male who presented with acute and very severe headache accompanied by vomiting. Now please observe that there is mild cerebellar atrophy, which is quite normal for the age. But as we go up, you find that the sulci are effaced and both the lateral ventricles are narrowed. Density of white matter is also slightly reduced. Apparently, there appears to be no lesion, which has resulted in effacement of the sulci in both cerebral hemispheres. But if you look closely, there are bilateral subdural hematomas. Please observe this line here, this one. This in fact is the subdural hematoma along the outer surfaces of right frontal, temporal and parietal lobes. This one here. And this is isodense almost density of the gray matter. Similar subdural hematoma is present on left side as well. The underlying, please observe this homogeneous texture here. Homogeneous texture here. These are typical of the subdural hematomas, which are bilateral, almost symmetrical. Their diameters were approximately 1.7 centimeters and 1.6 centimeters on right and left side respectively. Now please observe this slightly hyperdense area here. This one is suggestive of the hemorrhage. So these are the subacute subdural hematomas, and the underlying brain parenchyma is compressed. These may be very difficult to differentiate, so the answer is contrast enhanced CT scan or obviously MRI, and there is quite marked cerebral edema. This is the coronal scan. This is almost isodense to the underlying gray matter, but at places you do find slightly hyperdense hemorrhages. This one here. So isodense hematomas may be very difficult to differentiate from the underlying gray matter. But obviously at this age there has to be a cause. There has to be a reason for the compression of the sulci and narrowing of the intracerebral CSF spaces. Cerebellar folia, they are just normal for the age of the patient. So one has to be very careful in picking up these subdural hematomas, especially if they are bilateral and symmetrical.